Good morning. On behalf of Dr. Kolila Tibana, I come here to present this pilot that we implemented at immunization clinics in terms of using the risk screening tool for identification of high-risk women. As we know that the estimated vertical transmission rate in Mozambique is 10%. And in accordance with the MOH guidelines, breastfeeding women with unknown HIV status or undocumented negative status are offered HIV testing every 3 months until the infant's age of 9 months. This can be done at the health child consultation, pediatric immunization sector when they bring their children for the routine checkup. But also to optimize and retesting of breastfeeding, and we introduced the risk screening tool to determine HIV testing eligibility, and this was developed also and this was applied to all breastfeeding women eligible for retesting until 9 months postpartum in the 3 provinces. This is the tool that we introduced. This tool was applied by the counselors at Well Child Clinic, so we had lay people doing that. We expand this program of immunization in this sector where we would train the counselors in order to perform this screening. And all women with the unknown HIV status were tested as per MOH guidelines, but also women with HIV where they had positive results were referred to care, and their exposed children were referred to virologic testing and further care. For those who were negative, we still had the opportunity to refer to PrEP service. What were the objectives of this evaluation? Our primary objective was to determine the proportion of new HIV infections among breastfeeding women in 48 selected health facilities in the northern and central Mozambique. That was our primary objectives. In terms of secondary objectives, we had to determine the HIV status of HIV-exposed infants were born to the mothers with the incident of HIV infection in those 48 selected health facilities, also in the northern and central Mozambique. So we can see the provinces is the province that we see that is in the north, in the center of Mozambique. In terms of the methods, the retrospective cohort, using the data at the health facilities, we implement the screening tool, we use the early infant PCR registers, and we also use the medical files at ART service. The study population for this was lactate women with the negative or unknown HIV serostatus on those health facilities. As I said, we pilot in 3 provinces. In Zambezia, we had pilot in 19 health facilities. Zambezia is in the center of Mozambique. Nampula also in 19 health facilities, and Cabo Delgado in 10 health facilities, which are Nampula and Cabo Delgado are in the north of Mozambique. In terms of the sample size, we were expecting to recruit 15,363 lactant women with a complete HIV risk screening tool on average of 2,404 per health facility. In terms of ethical approvals, that was approved by the CDC and also by the Minister of Health and National Institution IRB. So what were the results? We can see the HIV testing results in lactant women showed a positivity rate of 0.4%. We could recruit almost 100,000 test results were performed. Most of our tests performed were at Zambezia province. We had 42,000 women that were tested, and we can see by the results that 99.5% of those women were HIV negative. Most of the women, we see that the highest were in Cabo Delgado with 99.7%. We had indeterminate results, which was 0.1%, but we had 401 and 0.4% of HIV positive, and the highest positive rate was in Nampula, I can see by 0.5%. For those ones we had the HIV positive result, which was 0.4%, we also could see about their children. And what we saw is that 6.7% of infants had no PCR done or no information about. And the highest province where we're seeing that there was not information about the PCR or not PCR done was in Zambezia. We had 11% of the children that they had no information about the PCR. But we had 93.3% of our infants with PCR done, and the highest was in Nampula province with 95.8%, and lowest in Zambezia with 89% that our infants that had PCR done. So we are losing here some opportunity of doing early infant diagnosis. But from those results that we had PCR done, we can see that 9 of them we didn't have any information about the PCR results, that 4 were in Nampula and 5 in Zambezia. But we could see also that 83.6% of them were PCR negative. And the highest with the PCR negative was in Zambezia province with 85.5%, despite of only have 89% of our children that were performed the PCR. We had one result that was discordant, that was in Nampula, but we had 16.2% of our children that they had PCR positive, like 59 of the children out of 374 were PCR positive. And the highest was in Cabo Delgado with 26.8% of the children with PCR positive, and the lowest in Nampula province with 14.5%. We can see in Cabo Delgado the PCR is very high, but as we know in Mozambique at this time, Cabo Delgado is the province that we have a military and we have a war in that place. So internal displaced is a lot, and it's not easier to really find these children and make some interventions. We can see that from those ones who were PCR positive, 98.3% were linked to the service. As I said, in Cabo Delgado, only 91% of them were linked to the treatment. So when we saw the follow-up is the same, what we're seeing, that we said 93% had the PCR done, 98 where the availability of PCR was 98%, the PCR positivity was 16%, and 98% of them were linked to the treatment. But also, we also asked them about what they knew about the results, so the self-report versus currently what we tested in lactant women. We had 87% of the women saying that were indeterminate, but when we tested them, we saw that 5.6% of them were HIV positive. We had 90,000 women who said previously were HIV negative, but when we tested them, 0.5% were positive, and we had 10,000 women saying that they had no information about previous test results, and when we test them, we had 0.7%. What we can say from this pilot is, despite of relatively low proportion breastfeeding women being identified with HIV, the vertical transmission rate amongst infants up to 9 months of age when newly diagnosed with women is very high, still very high, is 10%, one of the highest in the world. Suboptimal ART linkage among mothers infected with the HIV emphasized the need to understand the reasons behind the refusal of ART care in those seconds to avoid missed opportunities of early infant diagnosis. We can see that a lot in Nampula, that women refuse even know that they are HIV positive. Results underscore the need for optimized retesting strategy where a risk screening tool could identify HIV positive breastfeeding women as early as possible and promptly diagnose testing of their infants with timely initiation of positive breastfeeding women and infants out. We're still seeing women that coming late after 8 weeks to perform the early infant diagnosis. So our coverage is population is almost 73%. So there's a lot of women that are not coming to perform the early infant diagnosis very early. And ultimately, primary prevention and linkage to PrEP service are crucial to avoid new maternal HIV infection and prevent vertical transmission. Thank you very much.